Quinidine sulfate is a medication used to treat or prevent different types of irregular heartbeats, such as atrial fibrillation. It can help improve your ability to do normal activities by reducing the number of irregular heartbeats, although it may not stop them completely. Quinidine works by blocking abnormal heartbeat signals. Before and while taking quinidine, your doctor may also prescribe other medications, like blood thinners, anticoagulants, such as warfarin, and beta blockers like metoprolol, to reduce blood clots in the heart and slow your pulse. Before taking quinidine sulfate, your doctor may recommend a test dose to check for allergies. Take this medication by mouth with a full glass of liquid, as directed by your doctor. It's best to take it on an empty stomach, but you can also take it with food to help with stomach upset. Don't lie down for at least 10 minutes after taking it. Don't crush or chew extended-release tablets, as this can release all of the drug at once, increasing the risk of side effects. Swallow the tablets whole. There are different brands and forms of this medication available, and not all have identical effects. Don't change quinidine products without talking to your doctor or pharmacist. The dosage is based on your medical condition and response to treatment. If you're taking regular-release quinidine for an irregular heartbeat, the manufacturer recommends not taking more than 4 grams daily. Avoid eating grapefruit or drinking grapefruit juice while using this medication, as it can increase the chance of side effects. Also, avoid large changes in your dietary salt intake unless your doctor instructs you otherwise. Use this medication regularly at the same time each day to get the most benefit from it. And be sure to tell your doctor if your condition doesn't improve or worsens. If you experience diarrhea, nausea, vomiting, loss of appetite, stomach pain, or a burning feeling in your throat or chest, it is important to tell your doctor or pharmacist. This medication is prescribed because the benefits are considered to outweigh the risk of side effects. Many people using this medication do not experience serious side effects, but it's important to contact your doctor if you experience any of the following: persistent nausea or vomiting, changes in vision, muscle pain, signs of low blood sugar, signs of infection, easy bruising or bleeding, extreme tiredness, dark urine, yellowing of the eyes or skin, or swollen joints. Get medical help right away if you experience severe dizziness, fainting, or sudden changes in heartbeat. Although rare, serious allergic reactions can occur, so seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience symptoms such as ringing in the ears, sudden hearing problems, headache, blurred vision, or confusion, contact your doctor or pharmacist as your dosage may need to be adjusted. Some long-acting brands of quinidine may appear as a whole tablet in the stool, but this is harmless. If you notice any other effects not listed here, contact your doctor or pharmacist for advice. Before using quinidine sulfate to treat an irregular heartbeat, it's important to talk to your doctor or pharmacist about the potential risks and benefits. This medication is only recommended for specific patients. Quinidine, an antiarrhythmic drug, can be highly effective in treating heart conditions, but it may also rarely lead to serious and potentially fatal irregular heartbeats. It is crucial to follow your doctor's instructions and to be aware of any potential side effects. It is best to take quinidine sulfate at the same times each day, as prescribed by your doctor. Before taking quinidine sulfate, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to also discuss your medical history with your doctor or pharmacist, especially if you have certain types of heart disease, low blood pressure, a history of easy bruising or bleeding, severe muscle weakness, kidney or liver disease, asthma, or any current infections with fever. Quinidine sulfate may affect the heart rhythm, causing serious symptoms that require immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that may cause heart rhythm issues. Be sure to inform your doctor of all the medications you are taking and discuss any medical conditions you may have. Low levels of potassium or magnesium in the blood can also increase the risk of heart rhythm issues, so it's important to talk to your doctor about using quinidine sulfate safely, especially if you are taking diuretics or experiencing conditions like severe sweating, diarrhea, or vomiting. This medication may cause dizziness, and using alcohol or marijuana can increase this effect. Avoid driving or using machinery until you can do so safely, and limit alcoholic beverages while taking quinidine sulfate. It's also important to inform your doctor if you are using marijuana. Before undergoing surgery, be sure to inform your doctor that you are using this medication. If you are an older adult, you may be more sensitive to the side effects of this drug, especially dizziness and QT prolongation. If you are pregnant, discuss the risks and benefits of using quinidine sulfate with your doctor. This medication may pass into breast milk, so consult your doctor before breastfeeding. Drug interactions can change how quinidine sulfate works or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with quinidine sulfate include large amounts of antacids, certain antibiotics, antipsychotics, and other medications that affect the heart rhythm. Quinidine sulfate can also affect the removal of other medications from your body, which may affect how they work. Examples of affected drugs include aliskiren, codeine, and digoxin. It's important to note that quinidine is very similar to quinine, so do not use medications containing quinine while using quinidine sulfate. Make sure to follow your doctor's instructions and take the prescribed dosage at the optimal timing for the best results. If you suspect an overdose and notice severe symptoms like fainting or difficulty breathing, it's crucial to seek immediate medical help by calling 911 or the local poison control center. Symptoms of overdose may include severe dizziness/fainting, hallucinations, seizures. It's important that you do not share your quinidine sulfate medication with anyone else. Your doctor may also require you to undergo some lab tests or medical exams, such as a complete blood count, liver and kidney function tests, quinidine blood level tests, and EKGs while you are taking this medication. Make sure to keep all of your medical and lab appointments as scheduled. It's best to consult with your doctor for more details regarding these tests and appointments. If you forget to take a dose of quinidine sulfate, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. As for the optimal timing, it's best to take quinidine sulfate at the same time each day to help you remember. When it comes to storing quinidine sulfate, it should be kept at room temperature and away from light and moisture. It's important to avoid storing it in the bathroom. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of quinidine sulfate, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's important to properly discard this product and it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.